Now, researchers at the Centenary Institute in Sydney have found a possible treatment for prostate cancer.
More than 3,000 men die from prostate cancer each year. For more on this possible new treatment, we're joined by researcher Dr. Jeff Holst in Sydney. Dr. Holst, good morning. How did this discovery come about?
So for the last 4 years, we've been looking at prostate cancer, and we observed with prostate cancer that there's an increase in pumps that bring nutrients into and out of cells. And so we wanted to follow that, and we've been very nicely funded by Movember and the Prostate Cancer Foundation of Australia for these studies. And what we've found is not only are these pumps increased at 2 stages of prostate cancer, both the early stage and the late stage, but also that by blocking these pumps we might actually be able to starve the cancer and stop it from growing.
And how do you go about blocking those pumps, effectively starving these tumorous cells?
So we're in the development stages for that at the moment, where we're looking at developing drugs. But what led us to these studies in the first place was really ideas about diet and prostate cancer and how they might be linked. For Asian and African...
Yeah, on the diet, which would fascinate a lot of people, especially those suffering from prostate cancer.
So for Asian and African men, they have very low rates of prostate cancer, but when they move to the US, they end up getting prostate cancer at similar rates to the Caucasian population. Now, it's far too early for us to say certain foods are involved with that, but what our research is showing that these pumps bring in specific nutrients, and if we can try and work out whether either blocking these pumps with a drug or else changing the sort of nutrients in our diet, we might actually then be able to guide people on what diets may be better for prostate cancer.
And a lot of patients will be watching this and hoping that if this treatment comes off, it's going to prove much more beneficial and much more attractive to them than existing therapies such as surgery.
Yeah, for sure. We're a number of years off getting to that stage, but what we've been able to show, if you think of a cancer cell kind of like a teenager, the cancer cell has to eat more and grow more, just like a teenager in that sort of growth phase. And so just like a teenager eats too much food for that growth, the cancer cells need to eat more. And prostate cancer is a very slow growing cancer, so if we can just reduce the amount of nutrients getting to those cancer cells, either by blocking these pumps or perhaps eventually by changing certain things in the diet, then we may be able to slow prostate cancer. And because it's a disease of aging as well, we might actually end up dying of something else rather than prostate cancer.
Okay, Jeff Holst from the Centenary Institute, I wish you all the best with your research. Thank you very much for your time this morning.
Thank you.
You're watching ABC News Breakfast. These are our top stories today.